Couples match was definitely, difficult, physically, emotionally, mentally, all the things. It was really hard for us to kind of sit down and think about what are our individual priorities and then trying to put it together to see, okay, our priorities as a couple.
Couples match in and of itself is quite a beast. The matching process is not the most easy thing to do, even as an individual. It's clouded with a lot of uncertainty, and then when you take two people into the mix, it gets even more exciting, and so it can be hard to weigh exactly what you want in terms of potentially advancing your career or getting the placement that you want, as well as supporting your partner in the best way that you can.
It was tough. I mean, we, in the end, got very fortunate that we had a good amount of overlap in our interviews, so we felt pretty comfortable going into the couples match. But a lot of work went into that.
So we had lots of sleepless nights before opening that letter, but ultimately we were very excited about where we landed and are really excited for our next steps.
I cannot imagine it any other way, so I'm really glad we did it.
I'm headed off to Vanderbilt University Medical Center for my internal medicine residency. Medicine kind of came to me in a little bit of a roundabout way. For many years I was completely convinced, and even actually came to Augusta a long time ago in pursuit of becoming a biochemistry / maybe pharmacology researcher. After that, I taught and worked in a oncology clinic as a clinical trial assistant as an internship, and got a little bit more exposed to medicine. I really realized that was something that was super exciting for me. At that time, I was also a high school teacher, and I was having an absolute blast. So I wanted some way to be able to teach, work with patients, and also do research. And next thing you know, I kind of found the perfect job for me that I think would be what I wanted to do for the rest of my life.
So it kind of came to me, here and there. I wouldn't say there's like one specific thing that caused me to be like, okay, I definitely want to be a physician. One, instance that kind of sticks out to me is all throughout college, I volunteered with a hospice organization. And that kind of gave me a great example of, okay, I'm seeing patients, nearing their end of life, and seeing the physicians come in, seeing the nursing staff come in, the volunteers, and kind of like a whole, team effort come in and take care of these patients. That's like ultimately what led me to especially choose the specialty that I ended up choosing, obstetrics and gynecology. Ultimately want to pursue gynecologic oncology in the future, cancer research. Research is very important to me. It's also one of the reasons why I want to pursue gynecologic oncology as well, caring for women, but also being able to do that research. And I feel like in cancer research, everything changes on a day-to-day basis, which keeps everything exciting in medicine. So Charlie and I met actually a couple days before even starting medical school. Some of our friends got together to get a bite to eat before we started medical school. And, Charlie, of course, is being late, as he always is, and he walks into the restaurant and, right off the bat, everyone gets up, starts introducing themselves. And looking back, Charlie and I always laugh about it because for some reason, we were the only two people that hugged. We did end up spending a lot of time together our first and second year in these classrooms doing our case-based learning. So we got to grow very close during that time.
We worked together a lot in one of these classes and became very good friends, and then since then have begun an amazing relationship. And we're really excited actually to go to residency together and are recently engaged.